You're watching this because you have chosen to have some eyelid surgery with us, and I want to discuss realistic expectations for recovery time and potential risks and complications. Again, we commonly see other patients have been other places, had other surgeries. We're really good at revising those, but what has surprised me is the surgeon has never explained to our patient prior what the risk can be. And apparently that is not appropriate, because a surgeon should never delegate that to another healthcare provider, even a good nurse. So here we are explaining risks and complications, not because we see very many of them, but because that's what should be done, so you are well informed. Eyelid surgery can be very variable in recovery time. A simple upper eyelid skin excision, someone can be very presentable in 5 days and look great. Many times we're doing more extensive work than that to really rejuvenate the upper face. And what we would commonly recommend is to have a week to 10 days out of the limelight where you are highly visible. I would recommend not even working from home the first 3 days. We would recommend probably having to wear glasses if you go back to work for the first week or 10 days to hide some of the inevitable bruising that occurs. If you're going to be extremely presentable that stand up to scrutiny, we would recommend 6 weeks. And if you're going to do something epic like be on TV or be on wedding pictures, we would recommend 3 months. Risks of eyelid surgery: first, understand that like any surgery on the eye, including LASIK surgery, cataract surgery, any eyelid surgery, the eyes are temporarily more dry and require drops. So just understand you will need to be committed to that for several weeks. We have had no cases to our knowledge of any permanent worsened eye dryness, but that has been reported in the literature. There can be drooping of the lower eyelid requiring massage or taping, and rarely a touch-up tightening of the lower eyelid due to drooping of the lower eyelid. We do a lot of suspension of the lower eyelid during our eyelid surgery, so we rarely see that. With any fat transfer to the eye, there can be temporary lumpiness. 99% of the time that resolves. 1% of the time that can require either some steroid injections or even rarely a minor incision to remove an area of lumpy tissue. However, the rejuvenation achieved by fat transfer around the eyes is revolutionary. It has unparalleled results, and we will continue to accept a 1% risk of having to touch something up in order to obtain those amazing results. There are cases, 1 in 50,000, of blindness reported after blepharoplasty. We hate to bring that up. The risk of that is so low. Again, your and my risk of being hit by lightning in our lifetime is 1 in 3,500. You could honestly get struck by lightning 3 different times, and that is still more common than having blindness after blepharoplasty. I honestly don't know a surgeon that's happened to. In general, eyelid surgery is highly successful, one of the most commonly performed plastic surgery procedures done nationally and internationally. Our patient satisfaction rate has been extraordinarily high, and again, we look forward to an excellent result in your case.